Hi everyone, my flashcard this week is on pernicious anemia, which is due to a vitamin B12 deficiency, and this form of anemia is considered a megaloblastic anemia. So normally vitamin B12 plays a role in erythrocyte maturation through DNA synthesis. Absorption occurs in the ileum when vitamin B12 binds with intrinsic factor. In pernicious anemia, there is typically atrophy of the stomach lining, leading to a lack of IF production and subsequently a malabsorption of vitamin B12, hindering the maturation of RBCs. The RBCs produced instead are megaloblastic, meaning large, because cytoplasm maturation is not hindered. These immature RBCs die prematurely, leading to low blood counts. This commonly occurs in the setting of chronic gastritis due to the damaging effects of the epithelial lining. Lack of vitamin B12 may also cause demyelination of the peripheral nerves and spinal cord, causing neuromuscular symptoms. Risk factors for pernicious anemia include autoimmune gastritis and thyroid issues, alcohol abuse, gastrectomy, vitiligo, type 1 diabetes, cancer, pregnancy, age greater than 60 years, European descent, family history, certain medications such as antacids, proton pump inhibitors, and metformin, and certain infections including H. pylori, parasitic worms, and bacterial diverticulitis. Rarely, pernicious anemia is caused by a dietary deficiency of vitamin B12 because our bodies require a very small amount of vitamin B12 to function properly. Major signs and symptoms of pernicious anemia include this picture to the right, which is an enlarged red, sore, and shiny tongue, GI discomfort, paresthesia, and ataxia with nerve involvement, and typical signs of anemia that we see, such as weakness, shortness of breath, lightheadedness, and palpitations. Diagnostic testing include, again, for all anemias, we would see a low erythrocyte, hemoglobin, and/or hematocrit level. Specific to pernicious anemia, we would see a low vitamin B12 level, typically less than 200. We would see macrocytic or megaloblastic RBCs on a blood smear. And typically there's a high MCV, which stands for mean corpuscular volume. And this essentially tells us how large the red blood cells are. And these are very large red blood cells. Another test you would want to see is folate level. This causes a low folate level can also cause megaloblastic anemia, so you want to rule that out as well. Hypochloridria or achloridria on a gastric aspiration test may also be present, and this essentially is telling us there's a low or absent gastric acid level, which also correlates with stomach lining irritation. And that's it. Thank you.